Good evening and welcome to the COVID-19 pandemic update. I am Kayode Okikiolu. But first, the highlights. Federal government, with support from UNICEF and the EU, launches the National Social Behaviour Change Campaign on COVID-19. Zamfara State set to give Hajj pilgrims second dose of the Oxford AstraZeneca vaccine ahead of travel. British Prime Minister Boris Johnson is confident that vaccines are effective as the cases of the Indian variant increase by almost 30%. Well, over a year after COVID-19 changed the world as we knew it, and there is still a lot to learn and relearn about the virus and how to keep ourselves safe. We've had to learn and relearn how to keep our hands clean, how to interact with people safely, and just a few days ago, how to keep our hearts healthier and cut the chances of COVID-19 using underlying illnesses as an edge. Now, there are new and creative ways to pass the message across more effectively, and that's part of our package for you today on the program. But first, let's take a look at the latest COVID-19 trends here in Nigeria and across the world.
Figures from the Nigeria Center for Disease Control and CDC shows that Nigeria has recorded 31 new infections reported from 2 states and the FCT. Lagos recorded 18 cases, Rivers recorded 11, while 2 cases were reported from the FCT. The latest report also includes 0 cases from Plateau, Nasarawa, Sokoto, Ogun, Osun, Oyo, Ondo, Ekiti, and Imo states. The latest figure now raises the total number of infections in Nigeria to 165,809. According to the agency, no new death was recorded from the virus, leaving the fatality toll at 2,067. 5 people have been discharged in the last 24 hours after testing negative to the virus, raising the total number of recoveries to 156,420. Over 1.8 million eligible Nigerians, representing 91.6% of the target population, have been vaccinated so far. According to the National Primary Healthcare Development Agency, more than 50% of the target population in Cross River, Ekiti, Kwara, Lagos, Gombe, Zamfara, River States, and the FCT have received the first dose of the Oxford AstraZeneca vaccine. The agency has announced the commencement of the second phase of the vaccination exercise across states in the country, and the FCT is asking eligible Nigerians who've received the first dose of the vaccine to check their vaccination cards for the scheduled date to receive their second dose. Globally, there are more than 164 million cases and over 3.4 million deaths reported from several countries.
We all need to continue to remind ourselves to take the necessary COVID-19 precautions because the power to stop the virus is in our hands. Well, that's one of the messages from the launch of the National Social Behaviour Change Campaign on COVID-19 in the nation's capital, Abuja. Now, hands in this sense, by the way, is both literal and symbolic. So here's what hands stand for in the fight against COVID-19. H is for have your hands washed and sanitized frequently. And A, always cough or sneeze into your elbow. N is no going out without your face mask. D stands for distance of at least 2 arms length from others. That's if you don't have a ruler. And S, of course, stay indoors and self-isolate if you feel sick. This campaign is the result of a partnership between the Nigerian government, the European Union, and the United Nations Children's Fund, UNICEF.
And gentlemen,
the federal government is collaborating with the United Nations in Nigeria and the European Union to implement an integrated and innovative campaign to increase the number of Nigerians who believe in and practice COVID-19 preventive behaviors. Currently, many countries are going through a resurgence of the virus, with Nigeria taking proactive steps to secure its borders. Despite the decline in numbers of cases in Nigeria, these health experts harp on the need for all to be on guard to avoid a third variant.
As hard as we have worked, we must be aware of the dangers that could lie ahead. And so we must never get into a place of comfort where we start celebrating too early. as we look across what is happening in some other countries in the world, we are well aware of the work that lies ahead of us and the work we still have to do.
The pandemic is here. It hasn't gone anywhere. The virus is everywhere. It's mutating, it's adjusting to its different environments. To be able to survive and thrive, and with our hands, and only with our hands, can we ensure we can defeat it.
The European Union says the launch is part of their support towards the One Basket Fund.
The European Union and its member states, Team Europe, has mobilized 38.5 billion euros in response to the COVID-19 outbreak worldwide, of which 8 billion euros for Africa only. And this includes the over 2.2 billion euros to the COVAX facility to help secure vaccination for low and middle income countries. And we saw almost 4 million COVAX doses arriving in Nigeria last March. Also in Nigeria, the European Union has quickly allocated 50 million euros to the One UN Basket Fund in response to COVID-19.
Organizers of this awareness campaign have a bigger plan to take the message to schools and communities to enlighten students on the need to practice COVID-19 protocols.
And over to Zamfara State, where the government says all intending pilgrims have been vaccinated against COVID-19 in line with the requirement for those intending to perform Hajj in Saudi Arabia. The State Commissioner for Health, Yahya Kanoma, says in all, 30,690 eligible persons have taken the first round of the AstraZeneca COVID-19 jab across the state. Well, Zamfara State had earlier received 55,690 doses of the COVID-19 vaccines and later received an additional 8,000 doses. Now, 26,110 of those are left for the second phase.
The reason why we get additional 8,000 doses, we have fear that it will not be enough for us. But we make that request, and immediately we were given additional 8,000 doses. So that's because our people are rushing to get it. We explain to them that it's only the stakeholders, but we go above the stakeholders and other frontliners. Most of our people that are going to Mecca this year, we already make some flashpoint for them. I think when we receive the circular that all those who are preparing to go for Hajj, they should be vaccinated. There's no single pilgrims that he is not being vaccinated. We keep a special team for them, each and every local government, so that they can be vaccinated.
Now, away from vaccination, as the demand for intensive care equipment and personnel increases due to emergent diseases, the Yobe State government is training caregivers across its 5 general hospitals to minimize referrals of patients. The State Commissioner for Health, Dr. Babagana, shared this plan at an orientation organized for 10 workers nominated to undertake an intensive care unit training in Lagos.
10 personnel who have been nominated to undertake a 6-week intensive care unit training at Reddington Group of Hospitals in Lagos get the nod from the Yobe State Commissioner for Health, Dr. Babagana in Damaturu, where an orientation exercise is organized for them. At the end of the training period, this select group of people are to be ready to handle any health emergency with the necessary infection prevention and control skills required of people working with emerging diseases.
The government of His Excellency, Honorable Mayor Malabuni, in view of the need to provide high-quality services and provide the essential package of services that are needed, is establishing intensive care units across the hospitals, starting with the Yobe State Specialist Hospital here in Damaturu, and also optimize the ICU in the Yobe State Teaching Hospital here in Damaturu.
The exercise, which is conducted in partnership with Saving 1 Million Lives program in the state, has supplied a significant amount of equipment for the setting up of the intensive care units.
There's not any health system that call it is sub-standard health system without it having established intensive care unit and intensive care staffs as part of its component and end units. And this has been a dream of the Yobe State government, and of course under the initiative and the committee of the health sector lead, Dr. Mohamed Lawangana. I think he has advised His Excellency Governor Mai Malabuni. I think he's come up and accepted this training for our staff.
Assuring the Yobe State government that inshallah we will try our best to acquire all the knowledge that will be given to us, and we will come back to the state and work to fulfill all the mandates we have taken.
Some of the equipment they will probably be working with on their return to the hospitals in the state are bedside crash carts, infusion pumps, manual and automated defibrillators, and oxygen plant and ventilators.
So for more on this, we're joined by Dr. Babagana Abba, Project Manager, Saving 1 Million Lives Initiative, Yobe State. Well, thank you for joining us on the program, Doctor. We've seen the struggle for ICU care generally for patients severely affected by COVID-19. India is a reference. In fact, we saw that at some point in Nigeria where there were inadequacies. But for this we just saw, just how much will it boost our preparedness generally for a coming third wave and others?
Thank you very much. Once again, thank you very much, as you mentioned. So the Yobe State government, under the leadership of His Excellency Governor Mai Malabuni, is ever committed and is always his political will is always committed to support his government and Yobe State Minister of Health to ensure that the COVID-19 preparedness, among others, is being in place. Because even at initial, from the inception of 2019, I think when the pandemic started from in China, up to now, Yobe State has been at the top of the situation. This is the reason, one of the reasons why even the morbidities and the mortalities regarding COVID-19 is minimal compared to other states in the country. So in terms of the equipment, in terms of the infrastructure, in terms of other resources, the personnel, all being available, and of course, the government supported the Yobe State Minister of Health to ensure the citizens are well protected, and of course, in terms of the education and personal prevention and communication, and other the pillars of the COVID-19 management protocol. So I think the Yobe State government, and of course, and also the leadership of the Yobe State Minister of Health, Dr. Mohamed Lawangana, after they are able committed, I think, and stand on that part of the to ensure that there is no much escalation or much spread of the disease across the state.
And quite important to have a conversation around, making this available to the poor. I know ICU care is quite expensive, but we know that life is priceless. But let's touch on this just before we round off. The name of your organization is Saving 1 Million Lives. And I believe it's because an estimated 1 million women and children die yearly from largely preventable diseases. But now that COVID-19 is here, I imagine what that will have done to that 1 million estimate.
Yeah, I think one good thing with the program is Saving 1 Million Lives. It's not a standalone program. It's a system strengthening program, because this Yobe Saving 1 Million Lives is a unit, it's a program under the Yobe State Minister of Health. So Yobe Saving 1 Million Lives work plan and its operation is fit into the Yobe State health sector strategic health development plan. So there is nothing new. So all the interventions, all the activities are being conducted to curtail the COVID-19 pandemic, and also to ensure that all other service delivery across the state in the health facility and in the field being smoothly run, of course, being also being ensured that being in line with the health sector strategic development plan. So Saving 1 Million Lives doesn't have a new plan that is standalone. So whatever being implemented by Saving 1 Million Lives is what is in the needs and priority of the state under the leadership of our committed governor, His Excellency Mai Malabuni.
Well, Dr. Babagana Abba, we do hope that those lives are indeed saved in the coming years. But we'd like to thank you so much for sharing your thoughts with us on the program. Dr. Abba is the project manager Saving 1 Million Lives in Yobe State. Well, we'll go on a break now, and when we return, we'll bring you an update across some other states of the Federation and a quick look at what's happening on the foreign scene. Do stay with us. You're welcome back. Let's now take you across some other states for an update on their COVID-19 situation. Lagos State has extended phase 1 of the COVID-19 vaccination by 2 weeks, and that's in line with the directive from the National Primary Healthcare Development Agency. Well, the extension, which took effect from Monday, May the 17th, will last till Friday, May the 21st across 13 local government areas only. Lagos has so far given over 289,000 jabs. Well, elsewhere, the Imo State government says it will commence the administration of the second phase of COVID-19 vaccination this Monday. That's May the 24th. The Executive Secretary of the Imo State Primary Healthcare Development Agency, Reverend Sister Maria Uzoma, says due to the inability to exhaust the doses delivered to the state at the end of the stipulated time for the first phase, the state was given an extension to finish the doses and reach out to communities who had no access to the vaccines. Incidentally, the first phase ended today, and the agency is preparing to commence the second phase next week, as all modalities have been put in place to ensure that there is easy access. And now to Zamfara State, where health authorities say they will begin administration of the second dose of COVID-19 vaccines soon. Well, no specific date was given, but the Executive Secretary of the State Primary Healthcare Development Agency, Mohammed Addis, says 50% of the over 70,000 doses received have been administered. Well, from Nigeria, let's head to Europe and give you an analysis of what's happening regarding COVID-19 vaccination, easing of a lockdown, and so much more with Dr. Essien Okorobi, a general practice specialty registrar. He joins us from Birmingham. It's great to have you on the program. Well, the health minister earlier today announced that 28% increase in the Indian variant of the virus was recorded in the space of just 2 days. 2,300 on Monday, about 3,000 already. Do you think that's sufficient to maybe retract those easings that were recently announced?
Thank you very much, Kayode, for having me on the show. It is true that currently the Indian variant of the coronavirus in UK is increasing daily. And like you rightly said, we've seen a 28% increase. And there are concerns that the final stage of the lockdown, which is set to take place on the 21st of June, there are doubts that we would go ahead with that final stage of the lockdown. However, if you look at the facts about the Indian variant, scientists have discovered that it is not more transmissible compared to the dominant variant in the UK. It is also does not cause more severe illnesses compared to the Kent variants that we have in the UK. And among our over 60s, we have a very low number of the Indian variants. This is because nearly 90% of them have been vaccinated. And this shows that the vaccine is working and is effective against the Indian variant. So I think that with these things in place, the government might just go ahead to ease the lockdown completely come June the 21st.
I mean, for a lot of people, they want that to, of course, happen because they've been making plans. We'll get to that in a moment. But there are concerns about the clarity in government's messaging on whether people can go on holiday or not. Some have called it confusing or contradictory. Now, if you could just break this down, what do those new rules say specifically about traveling?
Right. I mean, the rules concerning traveling within the UK is quite clear. However, traveling abroad is not all that straightforward. So in the UK, you can travel between the devolved governments and there are no restrictions with that. But traveling abroad becomes a little bit more complicated. So the different countries have been sorted out using the traffic light system from countries who are tagged as green countries. So countries like Australia and Portugal, UK residents can travel to these countries without any restrictions and without having to quarantine. However, for the amber listed countries, which comprises many countries in Europe with holiday destinations, and Nigeria included, if you have to visit those countries, you then have to self-isolate or quarantine on your return in your home for 10 days, and as well as take the COVID test on day 2 as well as day 8 of your return. And then for countries that have been marked as red countries, so these are countries with a higher risk of COVID-19 and countries with new variants of COVID-19 like India, the government's advice is, as much as possible, do not travel to these countries except in most extreme circumstances. Now the problem is, who determines the most extreme circumstances? Because an extreme circumstance to one person might not be the extreme circumstance to another person. So
Absolutely.
It becomes a little confusing as to who can travel to the red listed countries and who cannot.
You know, I think I understand now where that confusion comes in. And, you know, some Nigerians have called for the country, I'm speaking Nigeria now, to be moved from the amber list to the green list. But maybe that's a conversation at the governmental level. But let's talk about the people there preparing for holidays. How are they approaching and planning for the holidays? Do you think maybe with cautious optimism, maybe one leg in and one leg out, or they're going all out for it?
I mean, to be fair, the past 1 year has been quite challenging and a difficult year for everyone. So it's pleasing to know that you're able to travel now. And I think majority of persons in UK would be approaching this easing of lockdown and oncoming holidays with some caution. A study showed that 4 in 5 persons in the UK would be spending their summer holiday within the UK. So that shows some level of caution, and I think that's the mindset of many people here in the UK, not to travel to other countries for holiday, but rather to pick a destination in the UK to spend the summer holiday. So I think they are approaching it with some level of caution. We're still in the middle of a pandemic, and it's important to be safe as well as protect other people.
Well, Dr. Essien Okorobi, a great place to live in. It's been a pleasure speaking with you on this. Thank you so much for your time.
Thank you so much, Kayode.
Let's now bring you more on our global update.
The British Prime Minister Boris Johnson expressed his confidence about vaccines' efficacy as he addressed Parliament today, saying they work against the coronavirus variant first found in India, with a leading epidemiologist saying it may be spreading less quickly than at first feared.
We've looked at the data again this morning, and I can tell them, the House, Mr. Speaker, that we have increasing confidence that vaccines are effective against all variants, including the Indian variant, to his point.
And in France, non-essential retail outlets have reopened for the first time in 6 weeks as the country gradually winds down its third national lockdown in a little more than a year. With infection numbers beginning to improve and a vaccination campaign gaining momentum, retail businesses and their customers are desperate to regain a semblance of normality. Economists estimate that the latest lockdown caused much less disruption than the previous 2 as people adapted to working from home and businesses forced to close got by on government handouts and furlough schemes. Austria has also reopened its famed coffee houses in a win back of its strict coronavirus measures from today onwards. Customers, however, must provide evidence that they have been vaccinated, tested or recovered before they can visit a cafe or restaurant, as well as reserve beforehand with name, telephone numbers and email address.
Well, don't forget to protect yourself. The virus is still out there, but stopping it is in our hands. And don't forget to visit our website, channelstv.com, for more updates and a better understanding of the pandemic. We also have all the big stories from politics to business, sports, and so much more for you. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikelu.